I'm Mayor Ron Nirenberg. I want to thank all of the parents and kids who have joined me today and my two guests this afternoon as we talk about the current situation with the COVID-19 pandemic as it is affecting everyone in our community. We understand that there are many parents and children in San Antonio who have questions and concerns about COVID-19, especially since school has started and students are going back to the classroom after many months of virtual learning at home. This is why we wanted to take the time to host this special event for our city's young people today and their parents to answer your questions. We also want to thank everyone who submitted their video questions to us in person. Let me introduce you to two special guests who are joining me today. First, I'd like you to meet Dr. Whitney Schwartz. Dr. Schwartz is the pediatric emergency room physician at Methodist Children's Healthcare. So welcome, Dr. Schwartz. Thank you for joining us.
Thank you.
I'd also like to introduce Mr. Claude Jacob. He's the director of our city's public health department. And recently, Mr. Jacob moved to San Antonio from Cambridge, Massachusetts. So now I have a couple of questions for our guests. And first, I want to start with you, Dr. Schwartz. Can you please tell all of the students and kids who have been tuned in this afternoon what you do as a pediatric emergency room physician and why did you decide to become a doctor?
Yeah, I became a physician because I think the human body and medicine are fascinating. And as a pediatric emergency medicine provider, I work only with kids and I see kids that come to the hospital, whether they be sick or injured, and I try to help treat them, fix them, and then determine if they're safe to go home or if they need to be admitted to the hospital for further management.
Excellent. Thank you very much, Dr. Schwartz. Now I want to turn to Claude Jacob. And Claude, I'd like to ask you, and again, welcome to San Antonio, by the way, Claude. Can you please share with our parents and children what your role as our city's public health, Metro Health Director is and what you do for our community?
Fantastic. Thank you, Mayor. So it's exciting to be here in the city of San Antonio. This is what I wanted to be when I grew up, which is to prevent the spread of disease, promote healthier lifestyles, and protect the community at large. So I come from a family of physicians and clinicians, and so I always wanted to at least do my part. But let me just say that we have an incredible team. We do whatever it is that we can to make sure that the San Antonio community is healthy and safe. And so we're just getting through this COVID storm, so it's exciting to share our feedback with each and every one of you. And I'm a parent of 3, so I gotta tell you, my kids talk about this a lot, and this is why we're having this forum this afternoon. Now, Mayor Nirenberg, Dr. Schwartz and I have a question for you. Can you tell kids watching today what you'd like about being mayor of San Antonio?
Well, first of all, I'm very grateful to be mayor, and I love my job. And the best part about it is getting to meet all of the people out in the community. Every single day, I run into people that we serve, and that gives me a great joy because I know I'm in a role that they look to help solve challenges and address issues in the community, and hopefully make their community a better place. And that is the best job in the world to me. Now, Dr. Schwartz and Mr. Jacob, again, thank you for joining us in this special town hall. And I'm excited to be here with you today because we are looking forward to answer some great questions from our young people in our community. But before we do that, I want to let you know that in addition to being mayor of San Antonio, I'm also a parent, and I am the father of a young son who just turned 13. He's been vaccinated and he just got back to school. And so I know many parents are out there as well who have questions about how they keep their children safe during the school year. It's been a very tumultuous year. I also want my son and all the kids in our community to be protected from COVID-19, which is why all students, teachers, and other staff in school now have to wear masks, right, because of what's happening with the Delta variant in particular. That helps protect you, your classmates, and your teachers. And so we thank everyone wearing a mask to help us stop the spread of coronavirus in the community. So now let's get to the questions that have been submitted by the children in our community. Ready to answer your questions about COVID-19, so let's begin, and I'm going to turn it right over to you, Dr. Schwartz, first.
Thank you very much.
Hi, I'm Abraham Gonzalez. Is the COVID vaccine effective against the different variants?
That's a great question. The COVID vaccine is very effective right now at preventing severe COVID illness, hospitalizations, and deaths. So currently in the United States, greater than 95% of those hospitalized are unvaccinated, and the vast majority of deaths in the United States are in unvaccinated individuals. So that tells us just how effective vaccines are. The next question is, well, can I still get COVID if I'm vaccinated? And the truth is you can still be symptomatic or asymptomatic with COVID if you've been vaccinated, and you can still spread it if you're vaccinated. You're just gonna get either no symptoms or very mild case of symptoms. So this is why it's really important that we abide by CDC guidelines with regards to masking, social distancing, testing, and quarantining to help combat this public health crisis. But again, want to stress, the vaccine has been very, very effective at preventing severe COVID illness, hospitalizations, and deaths, and that's definitely the most important thing.
What is a vaccine that you heard?
A vaccine is something that it triggers our body to make proteins to fight infection. Medicines treat and cure diseases. Vaccines prevent diseases. And so this is why it's really important to get them. Does it hurt? My friend, it is a small poke that lasts less than a second. And I guarantee you that small poke is a lot less painful than actually getting sick or being hospitalized because you're so sick. And in that case, you do get lots of pokes if you're hospitalized.
Why can't kids younger than 11 not get the vaccine?
That's a great question. I'm super excited to tell you that hopefully sometime this winter, we'll be able to have vaccines for children under 12. A bunch of research studies are going on right now with regards to that patient population. In medicine in general, we typically do studies in adults, and once we prove that they're efficacious and safe in adults, then we'll do studies in the pediatric population. Pediatric population, they might need a little bit of a different dose because of their size, and they might have different side effects because they're kids and not adults. So science's first goal is to ensure the safety of the products we produce, and so we're making sure the vaccine is safe for kids under 12 before we approve it for use. But hopefully this winter they will be approved.
How did the coronavirus get here, and why does it make people sick still?
That is a very good and complicated question. So we think that the coronavirus that is causing the COVID-19 pandemic came from another animal species. How and when it happened is still being researched at this time. Why does it make some people so sick and others not? Every individual's body has a different genetic code. So depending on that, some people can get really sick with the same virus that causes other people to not get sick at all.
Hello, and my name is Lukas Colon, and I am 10 years old. So I can't get the vaccine, so my question to you is, how do I stay safe with classmates aren't wearing masks?
Great question. It is a multi-pronged approach. So I encourage you to definitely wear a mask. When the vaccine becomes available for your age, I encourage you to get the vaccine. I encourage you and your friends to play in well-ventilated areas, like outside. I encourage you and your friends to clean up before and after all use areas. And then lastly, if you think you're sick or you think a friend's sick, encourage them to get tested and then quarantine if applicable.
Thank you, Dr. Schwartz. Now I want to go to you, Mr. Jacob, and answer some questions that we have had submitted by video from our young people. So the floor is yours, Dr. Jacob. Or, I'm sorry, the floor is yours, Claude.
Fantastic. I'm happy and here to answer any questions. I see we have a question from Caleb.
Hi, my name is Caleb, and I was considering to play sports for the first time, and I was wondering, what can I do to keep my family safe when coming home from practice?
Well, Caleb, great question. Again, I grew up playing sports as a young boy, and I encourage our children to play sports. Most of them play soccer. But I would just say that you have an opportunity to be safe. Right now, the best protection that we can share, especially with children, is to make sure that they at least wear a mask. We are encouraging folks who are eligible, if you're of a certain age that you can get the vaccine, we encourage you to get the vaccine. But at the end of the day, the best thing that you can do at home is just making sure that your hands are clean and that you practice good hand hygiene. And so wear a mask, try to get vaccinated, and wherever possible and feasible, just make sure you keep your hands clean. And so in the end, I love sports, and I encourage you to do the best you can on the field or on the basketball court or wherever it is that you like to play sports outside.
Did I have to use my mask to play outside?
So you asked the question is about wearing a mask when you play outside. Well, let's just know that the coronavirus, as you've heard from Dr. Schwartz, we're learning a lot about this virus. What we do know is that when you're outside, it's safer than when you are indoors. And so that's why you hear a lot of talk from adults about making sure that you wear a mask, especially in certain places when you're indoors. But you don't have to wear a mask when you play outside. And just know that while we're trying to encourage folks to model this behavior, it's a different way of getting around and just being safe. So you don't have to wear a mask to play when you're outside. But we do encourage children, especially if they feel more comfortable wearing a mask when they're outside. But by all means, whenever you're indoors, we encourage you to wear a mask.
Mi nombre es Luz. ¿A qué edad me puedo vacunar?
What Luz is asking is, what age can she get vaccinated? And you've already heard from Dr. Schwartz. So right now, the vaccines are available for anyone who's 12 years and older. And so we're hoping sometime by the winter that the vaccines will be available for anyone that's younger than the age of 12. But just know that you have to be at least 12 years old. Those vaccines have been tested. Those vaccines have been shown to be safe. And we're hoping very soon that the vaccines will be available for anyone who's younger than the age of 12.
David, I wonder, when is the virus going to stop? Is there a cure?
Well, thank you, David, for that question. So again, is there a cure? So right now, what we are showing, studies are showing that there is not a cure, but there are some things that we can do to protect ourselves. So we encourage folks to get vaccinated whenever you're eligible. We do remind folks to wear a mask to protect themselves. But at the end of the day, it's really about making sure that your hands are clean and that you try to be safe, especially so you don't spread germs from one person to another. So that's all we can offer you right now. And who knows? We'll see if there will be a cure, but for now, the best thing we can do is make sure that if you're eligible, that you can at least get the vaccine to protect yourself and your loved ones.
Mr. Cloud, what can I get a vaccine?
Wow, Marissa, shout out. So, thank you for that question. Just like we were sharing earlier, the vaccines have been proven to be safe and available for anyone who's 12 years and older. We're hoping sometime by the winter that the vaccines will be available for those who are younger than the age of 12. But you have to be at least 12 years old to be able to be eligible to receive the vaccine.
Thank you, Mr. Claude. You already have some fans out there. I love it. It's good to see that. And Dr. Schwartz, thank you very much for answering questions as well. I hear there are some questions that young kids have for me as well. So let's go to Daniela, who has a question for.
Hello, Mr. Mayor. My name is Daniela Lugo, starting 6th grade at Catherine Stinson Middle School. My question is the following. With the COVID numbers going up, will you consider the option of doing virtual learning?
That's a great question, Daniela. And, obviously it's very important. And I think that the research has shown that students should be in school if it's safe. That's the best place where learning takes place. And there's been a lot of complications, obviously, in the virtual environment for us to have learning take place during the school year. However, in certain circumstances, in particular when we have significant outbreaks in schools, that's not going to be possible. So we do want to have some options. Right now, that is up to the state of Texas to determine when that can be done, as well as the school board. So we, of course, want to see that flexibility so that you can have a safe and effective school year this year.
I know one bug. Is it safe for kids to go swimming when we can't wear masks in the pool? What about after school sports?
That is a great question, Mateo, and I think a lot of those questions I turn to my doctor friends, but I think I have asked this question before to them, and what they've told me is that if you're outside and you're playing and you're not really up close to somebody and personal, then it's okay to take your mask off. And of course, you don't want to be wearing a mask when you're in the pool because that can interfere with trying to get in and out of the water. So as long as you're obeying the guidelines that the health professionals have told you when you're outside of the pool, it's okay to take your mask off and go swimming and enjoy yourself. But again, when you're away from swimming and you're no longer swimming, make sure you get that mask on and protect yourself and those around you.
¿Por qué los adultos no se quieren vacunar?
Well, Jose is asking, thank you, Jose. He's asking a very important question, which is why some adults don't want to get vaccinated. And that's a question that we've been grappling with, and frankly, it's very difficult. A lot of people who are eligible to vaccine have not gotten a vaccine, maybe because they haven't heard where they can go get it. Maybe they've heard some misinformation about it, like it might cost too much money, or they need insurance, or that it's dangerous. All those things are not true. The truth is the vaccines are safe, they're effective, they're free, and they're widely available in our community. So if you know someone who is eligible to get the vaccine, make sure you encourage them to get it, because that will help protect them, and will also help protect the people around them, especially those who aren't yet eligible, those who are too young to get the vaccine. When we do our part, if we're old enough and we're eligible to get vaccinated, we help everyone else in our community. So great question, and we're going to continue to work on those who haven't yet gotten them.
Hi, I'm Violet October Chavez, and I'm a Brownie Girl Scout. My question for Mr. Mayor Ron Nierenberg is, will the state coordinate with the Girl Scouts to set up vaccines for our members?
That's a great question, Violet, and I don't want to speak for the Girl Scouts, but my wife is on the board of the Girl Scouts, and we're big fans of what you all do. And what I will tell you is that our Metro Health Department wants to find everyone and everywhere that we can provide vaccines safely for folks who are eligible. And so if the Girl Scouts want to partner with us and set up a pop-up clinic, we'd love to talk to the Girl Scouts. That's a great question, and I would encourage your leaders to get in touch with our Metro Health Department. Maybe we can set something up.
How did the virus get stronger?
Thank you, Zoe. That's a really important question about why the virus gets stronger. And I always ask my doctor friends about this, and what they tell me is that the virus gets stronger when we allow it to live for a long time in our community or in our country. That's why it's so important that we do everything we can as a community to get rid of it as quickly as possible. That requires vaccines, that requires masking up, that requires us doing everything we can to slow down the transmissions and the sickness in our community. The longer it is allowed to live out there, it gets resistant to the tools that we have available to stop it. So let's all do our part, mask up, get vaccinated, and we can get rid of this thing and no longer see it get stronger.
Ron, how can we stop COVID cases from going up?
Great question, Eduardo, and I think it's a good one for us to reflect on, because it's almost the same as the last question. How do we keep the cases from going up? And remember, cases means people who are sick, and we don't want to see people in our community that are sick, right? So let's work together to slow this down, make sure that we don't see any more people get sick that don't have to get sick. And how do we do that? Everyone has a role in it. Wear a mask, regardless of whether you're vaccinated or not, particularly when you're out in the community with a lot of people close together, like in your school. Or if you're, and if you're eligible to be vaccinated, go get vaccinated. And I know you know people who might be eligible to be vaccinated. If you're not, encourage them to go do that too, because we all have a role to play to keep from more people getting sick in our community, and we can end COVID-19 together. That's what Olivia wants to know.
How did the second virus start?
The second wave? That was, the variant, Delta variant? I think it was the same as that last question, where it gets stronger, so the virus mutated, and it became a kind of mutation that spreads very quickly. So regardless of whether people are vaccinated or not, they're able to catch it and get infected, and sometimes they don't even know. And because they don't know, they're out and about, and they spread it to other people really quick. So, and you can fact check my answers with the doctors that are over here.
So, hey, that's a great question. He's right. All viruses in general mutate. That means they kind of change the longer they live. And a lot of these changes don't make too much of a difference, but every once in a while they'll make some big differences. And so the longer a virus is out, the more likely that the more time it has to change to where it causes a big of a problem. And so the coronavirus, it mutated, and now this new strand, the Delta variant, spreads really fast. So the old strand, if one person was sick, they could get 3 other people sick. With this new strand, the Delta variant, one person gets sick and it gets 8 other people sick. So it's spreading really fast, and that's why we're seeing a huge upwave in hospitalizations and deaths in this new wave of the public health crisis.
Great question. We're learning a lot about this virus each and every day. It keeps us on our toes. It keeps us vigilant, so we're paying attention to what happens. So just like you heard from the mayor and you've heard from Dr. Schwartz, we're learning about this virus, but what we do know is that it keeps changing, keeps mutating. So the best thing we can do is make sure as many people get vaccinated as possible, just to make sure that we can continue to protect ourselves and our loved ones. So great question. We're paying attention. We're learning a lot, but at the same time, we're doing our best to make sure that you and your family members and your friends are protected. Thank you.
Thank you.
Great question, Olivia. Well, our special event is unfortunately at the end. I want to thank you, Claude Jacob, our Metro Health Director, as well as Dr. Whitley Schwartz from Methodist for being here. We've really enjoyed some time talking with our kids and parents today. We truly enjoyed hearing from all of you and want you to know that we care about your concerns and we want to know what's on your mind regarding COVID-19. But before we leave, we do want to remind you to please wear your masks in school, wash your hands frequently, and try to practice social distancing whenever possible. And let's put an end to this pandemic and get on with a great school year. Have a great day.